You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, TMJ treatment and relief. With us, we have an expert on this topic, Dr. Siman. Dr. Siman, welcome to the program.
Thank you, Randy. It's nice to be here.
All right, now, before we get into today's topic, for people that don't know your practice, I mean, who is the typical patient that's coming in for this TMJ treatment, TMD? In fact, on your book, you call it TMD, TMJ. What's the difference, and what are the symptoms?
Well, TMJ is basically the acronym most people think about the temporomandibular joint. It's the joint that joins your temple and your mandible together. But the disorder itself, it's called temporomandibular disorder. For that purpose, some people call it TMD, some people call it TMJ, but that's more of a familiar name for it.
So let's begin with the typical patient you see that comes in and they've identified themselves, I guess, having a TMJ problem.
Well, the typical patient is like the mom who is having migraine headaches a few times a month. It is the college student who's grinding her teeth and she has her jaw that clicks and she can't figure out what's going on. She can hardly open her mouth to eat a sandwich. It is the police officer who comes in who's having all these unexplained neck tension, and he's been to various specialists and they don't know what's going on with her. It could be anyone, young or old, that has all different types of degrees of ear congestion or ringing in their ears. And
ear congestion?
Yes. They have been to various specialists, let's say ENTs, and they have been treated many times for the wrong thing. They thought they had an ear infection. They were prescribed antibiotics. And after all these years, they're trying to figure out what's going on, so they end up in my office. I actually get results with these people. So when they come in, the lady that has migraines, after I start treating them, a few weeks later, the migraines are less in frequency, and in a matter of a couple of months, they're actually eliminated. These patients that are coming in, they can't bite into a sandwich, and after we treat the problem and they get their jaw in a relaxed position, they can actually eat better, and their life improves. Okay. We've got the people with the ear problems that have had all types of pressures on their ear. If you think about it, your jaw joint is so close to your ear. If you really want to see,
so it's like right there in front of the ear?
It's right there. If you really want to see where it is, if you stick your fingers in your ear and you move your jaw around, you could actually feel the jaw moving. That's how close it is. So there is a big correlation between ear problems and the position of your jaw. And that's what we are able to determine.
Now, what about moving over to the chronic headaches or people that get a lot of headaches? How is it connected to here? I mean, how is it if you have a cluster headache or a different headache? What's the connection? Help me understand that.
Well, think about it. These are muscles. They are muscles that are used to move the jaw in various movements of the jaw. There are muscles that we use to open the jaw. There are muscles that we use to move the jaw from side to side. And if these muscles are under fire, it causes pain in different areas of the face, our head being one of them. So when your jaw is not in a correct position, the muscles are in spasm. And as a result, you start getting the tense. Well, you start getting the symptoms. You're wondering what's going on. What does my head have to do with my jaw? Well, it has a lot to do with it. These are muscles that are attached to the jaw. So if the jaw is not in its correct position, these muscles are in spasm and they're always firing. So it's like working them out. Imagine you're going to the gym and you're picking up a weight and you're working your biceps. And these biceps are always tense. And if you don't take a break, maybe for a day or two before you go back and work on these muscles will continue to be tense. So that's what's happening with these muscles of the head, the jaw, and the neck.
So the way the teeth come together.
That's correct.
You called it a happy place.
That's correct.
What does that mean?
That's correct. Well, I have this term. It's called a happy bite. And what's a happy bite? A happy bite is where everything is happy. Basically, the way that your teeth come together is in a position that your muscles actually like it.
Like they're relaxed.
It means they're relaxed. They're in their relaxed position. I mean, if you try to move your jaw in a certain position and hold it there, you're going to feel that these muscles are going to become tense. Imagine if the way your teeth come together, these muscles don't have a choice, and they always have to be there. So what happens is people tend to grind their teeth because they're trying to move.
So this happens at night, like when you're asleep.
Yes.
That's where you're...
Well, a lot of it happens at night. A lot of it happens during the day. There are people that clench their teeth. There are people that try to move their jaw to a better position. Oftentimes my patients tell me, if I put a finger in between my teeth, I feel better. Why? Because they're trying to move that jaw to a happier place. And that's what's causing the problems that they're having.
Okay, now I went to your website. Your website has patient after patient after patient that is bragging about you and the results from your TMJ program. What do you call it? Do you call it a TMJ program? You call it?
This is basically a way to get rid of your pain, of your TMJ pain. There is not a program for that. It's relief, basically. Giving you a happy bite. My job is to give you a happy bite. So once I find that happy bite, everything else follows. The migraines go away, the neck problems go away, and I have patient after patient in my website, that are talking about their stories.
Within the first couple of weeks, I noticed it subsiding pretty quickly, but then probably within a month or two, a couple of months, I started really seeing the big results. A big change in the pain in the jaw and the headaches and the neck pains. And, it was just kind of cascading all the way down to my arm. My arm was numb before doing this, and now my arm is not numb anymore, and the headaches are gone. And it's better. My wife is a lot more happier. She notices I'm not in as much chronic pain, and she was concerned. She's like, was wondering why I was in chronic pain all the time, and you need to do something about it. And she wasn't educated in TMJ, and we really didn't know about it. And so the quality of life has improved a lot. So I'm very thankful for that. Taking pictures are better too, because I'm noticing I don't look so weird in my pictures.
I kind of just reached a critical point where I was like, I'm in so much pain, I have to address this. I have to find someone who can help. I could tell after 3 days that it was making a huge difference, this appliance. And I could tell after 3 days that it was changing my bite, and that was what was making a huge difference.
My pain has improved so much. I'm pretty much symptom-free. I felt better the first time I came to see him. It was the first time I'd had TENS therapy performed on my jaw, and that helped immensely. I went home and couldn't believe how much looser my jaw felt. With the orthotic device, relief was pretty immediate. Within the first week, my symptoms had decreased by about 50%.
You do see reversals? That means people with really bad symptoms of like headaches, ear problems, are reversed, and their teeth are the connection.
Definitely.
Is this, for most of these people, is this the first time they've heard anything like this?
Yes, well, let me tell you about, I would say there is no exact statistics about this, but I would tell you that 70% of the population has some type of a TMD problem, whether it's related to their headaches, their neck problems, their clicking of their jaws, their grinding of their teeth, or various symptoms that are associated with it. But people don't know about this problem because you wouldn't think that you would go to someone like me if you were having constant neck problems. I mean, who would you go to? You would go to a chiropractor? You would go to
work with chiropractors?
Of course I do. Yes. You would go, well, chiropractors actually refer patients to me. So we are able to resolve the problems together. There is definitely a factor involved with the muscle spasms that are related to the jaw. And sometimes we have to consider the other factors because our neck is attached to the rest of the body. And there are muscles that are associated with that in our cervical areas that are sometimes caused by the problems of the neck, not necessarily the jaw. Randy, I have patients coming in. I have pain patients. So I see a lot of pain patients. They come in and I examine them and I look at these muscles and I touch them, and I can barely touch these muscles because they are so tense. So they're sore? They're almost very sore, extremely sore. There are muscles that I could put my finger on, and with the lightest amount of pressure, they feel pain. I mean, I tell them, scale of 1 to 5, what is this? They say a 5+. So we try to relax these muscles, and we try to find the correct and happy jaw position for them. And I test it in there. I find this position, and I just have them test it. How does it feel? They say, oh my God, I feel so much better already. We haven't even started the treatment. The idea is, where is that happy bite? Let's find it, and let's keep the patient in that bite. And that's what's going to give them the relief. So do you have patients, by the way, that have weaned off medications? Yes. As an example, I had this 45-year-old lady. She was on Imitrex, Ralpax for many, many years. And she was waking up with these terrible headaches. After we started treating her, in a matter of weeks, she reported to me that she's barely getting any migraines. And she's no longer taking the medications, of course, working with her doctor. Actually, we were able to stop that. So this is an incredible science. Well, I had this other guy that, was getting like migraines, maybe about 10 times a month. And he would tell me how many days of work he had missed. And you have to understand, in the United States, there are so many people missing days of work because of headaches. The majority of my patients that are headache patients are females, but I do get quite a few males as well. I remember this one guy coming into my office and complaining of these headaches. I mean, I looked at him. The guy had his bite that was way off, his muscles in complete spasm. I looked at his teeth together and I said, I can solve your problem. And he said, how could you do that? And I tell you just got to put your jaw in the right place. I mean, he was not a believer.
So you could tell by looking at the teeth, the way they're worn?
A lot of times. I could tell about the way your jaw is positioned. I mean, if your bottom teeth are kind of locked behind your top teeth, I mean, that's a big indication that your bite is not correct. And people don't pay attention to that. So these are just red flags that a lot of times we notice. So this particular guy, I said, this is not a problem. I'm going to put you in this appliance. Let me test drive this new jaw position for you. He said, how are you going to do that? I said, I'm going to make you this appliance. I want you to wear it, for a few months. And then let's see if your symptoms go away. And he says, then what? Do I have to wear this for the rest of my life? I said, no, I could fix it. He said, how could you fix it? I said, I'll fix your bite. I'll fix a few teeth here, a few teeth there, and then I'll put you in that new bite position. And I did, and I changed his life, and he was off his medication forever.
We talked on the phone. You said that the way TMJ problems are currently commonly being treated are much different than the way you do it. So tell me about the current treatment for this problem by dentists and what you're doing.
Well, the common treatment for a TMJ problem is a night guard. So most people that are wearing their teeth down, they got short teeth, and they go to their dentist, and the dentist says, I got to make you a night guard because you're wearing your teeth down when you're sleeping. They make him a night guard. And the truth is, most of these patients wear the night guard, but the only thing that this night guard is doing is preventing them from wearing their own teeth down. So they grind on the plastic, basically. That doesn't stop the problem. So most of these patients come in my office. In fact, some of them come with 3 or 4 of these appliances made by different people, and they tell me none of them worked. So what is it that we do here? We're trying to find that jaw position where the patient is actually comfortable. So we are trying to relieve the symptoms and correct the cause of the problem. So where is the problem coming from? It's coming from a jaw that is not positioned properly. It's coming from teeth that are not meshing properly. So we are going to find that correct jaw position and fabricate an appliance where we actually put that patient in that position versus a night guard. So all this night guard is doing is basically...
It's just keeping you from wearing your teeth down?
Exactly. It's a piece of plastic in between your teeth. As far as I'm concerned, you can take a pencil and stick it between your teeth, and you're going to change the position of your jaw. But is that the correct position? The problem is not putting an appliance in your mouth. I want to tell my patients that I'm going to make you an appliance. Oh, I've had a few of those before. They're thinking like, oh, this is another guy that's going to make me another appliance.
All right.
But this time around, this appliance is going to be made in the correct position. And how do we know that is correct?
And how do you know the correct position?
Great, because that's a great question you ask. That's what differentiates this treatment, is because we are using technology to actually relax the muscles of the jaw, to find out where is it that these muscles are relaxed. We can actually hook the patients up to these very fancy equipment and figure out if these muscles are relaxed, or they're firing, or are they calm. And that's what we follow in order to find the correct position for the patient. And that's ultimately what's going to give them the relief. So the typical patient comes into my office, they have headaches and they have some problems. They got some ear congestion, they got ringing in their ears, and their neck muscles are really sore. I actually press my finger and go, oh, and I say, do you have neck problems? Most of them, yeah, you know what, I sit behind the computer every day and my posture is not correct. Everybody has an excuse for their neck problems. I mean, people live this world thinking like their neck problems are just normal, but it's not. I mean, if you got this jaw here and these muscles tense pulling on this every single day and night, what if we took that pressure off? And you look in this guy's mouth, and what has he got? He's missing his back teeth. His bite is over closed. You can barely see his bottom teeth. The guy is suffering. And I've got the key to that. I've got the power to just fix that. It's like I can look at the guy and I say,
So you can look at their
feel
teeth
it.
and know, like, this is going to be easy?
Yes, but it's not that simple. I mean, it's not just by looking at it, say, oh, this guy is diagnosing people by looking at them. No, it's a lot of tests that I do on the muscles. Then I take a CT scan of their jaw. You know, it's very simple. It's not like one of those scans where you go to the hospital, you got to sit in this tunnel and, you know, it's not, you get
Okay.
claustrophobic. People think it's a CT scan. No, it's a simple machine. You sit there, this machine scans your jaw. You know, it's a cone beam machine.
What do you charge for that?
It takes, for my patients that come to me for a consultation, it's complimentary.
So what does the CT tell you?
Well, let's back up a little bit.
Okay.
You were just asking me, how do you know? Just by looking at someone's jaw or their teeth, you know if they have a TMJ problem or this is related to their neck or their headaches. Well, of course I know because I've done this, you know, for many, many years, and
28 years you've been doing
yes,
it.
28 years. I can diagnose a patient. I mean, I could be walking, you know, with my wife in the mall, and I look at this guy. I say, this guy is going to be having headaches. Just go talk to him. You know, it's very interesting, but there's more to it than me looking at them. You know, I examine these muscles. I feel them. I touch them. I change the position of the teeth. I had my patient move their jaw around to see what kind of limitations they have.
So you see reversals in
Absolutely.
migraines?
Absolutely.
Clicking, popping, all that stuff?
Clicking. There are patients that had clicking and the clicking is gone. Headaches are gone. Neck problems are gone. Shoulder problems are gone. You know, ear congestion is gone.
When you say congestion, what do you mean? Like, what are some of the ear things that may be connected to the TMJ?
Well, once again, this joint is so close to your ear. I said you can stick your finger in your ear and see how close that is. Imagine how you feel. Like if you press your finger right here, you know, you feel a pressure there. Imagine there's an internal pressure over there that is so close to that. And how can we determine that? The scan actually shows that. When I got
So your
patients,
CT scan shows?
of course. I have patients that are complaining of ear symptoms, and I look at the scan and I'm able to look at all these slices. I mean, I could just microscopically look at the proximity of that, and I can see how close that is. I can show it to my patient. So what happens? What are the results? What happens when we put that jaw in its right place? It heals because it moves away from there. It doesn't even want to be there. That's what we're able to do.
So the part I just want to know is, so you don't like night guards, right?
No, I don't like them.
Because during the day they're not help. So are you just giving them a guard that they wear 24 hours a day?
It's not that simple.
Okay.
I mean, there's so much that you could do. Sometimes, if for every patient that's different, you got some patients that are missing some back teeth. Maybe they're going to need a few dental implants there to restore that position. We have to restore function and balance within the jaw. So you have to understand. I mean, you've got your two joints right here. Imagine you have a pair of shoes, and one shoe is taller than the other one, and we have to have balance up here as well. If you're missing a whole set of teeth on one side and this side is carrying all the weight, what's going to happen? What is it that's moving the jaw? It's the muscles. The jaw doesn't move by itself.
So you may have to fix their teeth as well.
That's correct. A lot of times we have to do that. For some patients, we're just able to treat them with the appliances that we make. For some patients, we might have to do some other work. It's like every patient is customized to the treatment. But I tell you one thing,
All right.
Whatever we do, we want to make sure that you are comfortable before we do any kind of dental work on you. That's not the idea. Our goal is to get the patients to a comfortable position. And that's 100% reversible.
You know, I was just taking Excedrin pills every day or ibuprofen mostly every day just to get the headaches going because I used to have to work like that and stuff like that. But now it's like I don't take any more aspirins or anything like that. It's been a major improvement on my headaches. I don't snap at my kids anymore. I don't snap at my husband. I'm more relaxed. I'm less stressed. It's perfect. It's good. After my treatment, I'm doing much better. I don't snap at my husband anymore. I'm less stressed. I'm more active. I have less headaches, and I'm doing much better thanks to Dr. Siman.
With the appliance, and you know, almost like within the first 2 weeks, my sinuses cleared up. I didn't have any post-nasal drip anymore. When I came in this morning, I said, so that whooshing in my ears is completely gone. I can bring in pictures of myself, you know, knowing I was in pain, and you can see it. I can see the difference. Or just for me, I'm not crazy. I am, you know, all of those things were a result of my TMJ.
Let's talk about your book. I guess people, if they go online, they go to your website, you'll send them this book. Very informative book.
Yes.
Who do you want to read this book?
Anyone that has any of these symptoms, anybody that has had a major headache that has not been improving over the years, if you have constant neck problems, if you get these clicking noises in your jaw joints, if you have trouble opening your mouth wide for whatever reason, if you haven't been able to bite into a sandwich, if you wake up in the morning and you feel tension in your head, neck, and shoulder muscles, you are most likely a TMD patient, and you need to know what's available there for you to explore out there. So in this book, which is written in very simple terms, by the way, I share this book with my patients, I share it with other doctors, because most doctors that treat this problem are pain management doctors. And what do pain management doctors do? They give you medications. I mean, doctors are there to treat an acute problem. But this problem is a chronic problem. We have to see where the source of the problem is and fix that for good. We can't be taking medications all the time. We can't be going to physical therapy 3 times a week for the rest of our lives. We cannot be constantly getting chiropractic visits thinking, okay, when is this going to end? Well, let's find where the source of the problem is so we can fix it. So
predictably, on a consult, somebody comes in, obviously sore here, migraines, unexplained migraines. They think they've tried everything. But on your consult, I guess you hook them up to this technology, do a CT. With what predictability can you say, you know what, I think you're going to be a good candidate?
I tell you, if I don't think that I can help a patient, I tell them outright.
Does that ever happen?
I am not there to waste my patients. My success rate is extremely high.
Okay.
So it's like, I have patients that have come to me and they ask me, what if this doesn't work? They always ask me that. I say, I can only tell you about my success rate. And I have been able to give relief to thousands of people.
Are there really a lot of people, a lot of women in particular, that have this headache problem?
I would say millions. I could say millions. You could probably fill Staples Center with women that have some type of a TMD problem, whether it's headache, whether it's some kind of a, neck issue, jaw issue, clicking issue. I mean, they're all over the place. It's just that
they don't know their options.
They come to me when the pain gets so debilitating that they don't know what to do with it. It's like a lot of times
you're the last resort guy.
I am the last resort. A lot of times they've been to, as I said, all these doctors, they have been, what do you do when you go to a neurologist and you complain of headaches? I mean, there was my sister a few months ago. Her headaches were not going away. And I
so did you, with your own sister, have a hunch that maybe
I tell you a story.
Her teeth had something to do with it?
I tell you a story. My sister's been complaining about these headaches, and I keep telling her, why don't you come to the office, let me check your jaw. I said, yeah, right. I mean, I've got all these headaches. I've been to all these prominent specialists.
She thinks you're crazy.
You're crazy, and you're gonna think my jaw has something to do with it. So I said, okay, there is this neurologist that I know. He's a very prominent neurologist in Los Angeles. I said, let's go see him because I want to go with you. And I happen to talk to him once in a while. We exchange patients. And I said, this time I brought my sister to you. Okay. So what are we going to do with her? So he looked at her and he says, you're so young. These are the choices. I can take a brain CT. Most likely it's not going to show anything. I could run all kinds of tests. And basically, these are the choice of medications that you have.
And her problems were headaches.
Headaches.
She couldn't get to the bottom of why she was getting so many headaches.
Mainly headaches, yes.
Okay.
So I said to my sister, okay, why don't you just let me try? You don't have to pay for it.
Family members don't want to listen to their doctor family, right?
No,
okay.
And time after time, I just go there, we're talking in conversations. They have seen, some of my publications, my ads, and they were never believing in that. So I said, I actually, started to figure out what's going on with my sister's jaw, and all these years, she had a jaw that was not positioned properly. So I basically treated my sister.
Okay.
And now she's feeling much better. Now, what happened is...
Did you say I told you so?
No, the funny thing is that after I talked to the neurologist, since then he has sent me 3 other patients.
So you really believe you're changing people's lives?
Yes. I mean, imagine if you got chronic neck problems, you can't do gardening, you can't pick up your grandkids. There's so many things that you want to do that you can't do. And all of a sudden, you're able to do those things. That's what my patients tell me. My patients tell me, I had this lady who was so depressed on all types of antidepressant medications because of these chronic headaches. And now that she didn't have them anymore, you know, she could do so many things. She actually starting a new company. And, you know,
because when people feel good, they're more motivated, I guess, to do things.
Absolutely. Imagine you wake up every morning and you got a sore mouth. Imagine you're going to a restaurant and you want to order something nice you want to eat, a piece of steak or something, and your jaw is hurting so much that you can't chew.
And there's that many people out there? Because I never hear about sore jaws.
I mean, how many people do you know that can't open their mouth and bite into a burger?
I don't know one.
I see a lot of those people.
So they're all over the place.
They're all over the place. I mean, they say the last time you bit into a burger, I don't remember when that was, they tell me.
Really?
Yeah.
And that's fixable.
That's fixable.
You see that all the time. Now, we haven't mentioned, look, you've written a book on TMJ. You've also written a book on aesthetic dentistry. You call it life-changing transformations. By the way, beautiful before and afters in there.
Thank you. Well, you know, the emphasis is this. You know, we can do cosmetic dentistry. We can all make people look better. We can make them, a few veneers and do all that. But the idea is, what about the jaw? Well, all you do is, because you're trying to give people veneers without fixing their bite, that's not going to last. You get these short teeth that were worn down, for whatever reason it was, which is because of the jaw position. And then you are putting these fancy veneers on it. Soon they're going to break. And that's because the jaw is not in its proper position. Well, what are the other benefits of that? Patients come to me for cosmetic dentistry, but I say, I'm not just going to make veneers for them. First, I want to make sure that I'll say, oh, you got another problem. I say, I look at them. Do you get headaches? I touch their muscles. Do you get this? Yes, 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 yes. Great. Now you're killing all these birds with one stone. Okay, I'm going to fix your teeth. I want to make you look good, but as a bonus, this is what you get. And vice versa. I mean, there are patients that come in because of that TMD problem, say, Dr. Simon, what about, can you put my teeth permanently in this position? I said, yes. Then the smile becomes a bonus for those people. Okay. Because we get rid of the pain, and now they have a beautiful smile, and that's why we call it a life-changing transformation.
So we're out of time. Final message to somebody that has the migraines, they have the clicking, the popping, soreness, all of those things. But they're skeptical still, right? Like I am. Yeah. What do you say to them?
Well, think outside the box. You think about it, you have nothing to lose. Come in. I would like to examine you. I would like to take a look at you. And I would like to run some tests on your muscles. I would take a CT scan. I won't charge you for the scan. I'm just going to show it to you to see what's going on. And if I can help you, I'll let you know. And if I can't, I will let you know as well.
All right. I want to thank you for coming on the show. Very good. Very good. It's a pleasure. You've been watching The Wellness Hour. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.